Hello, my name is Carmen Burke, and I am here to read with you the post-op instructions when we do an extraction in our office. Please contact us with any questions or concerns. Our phone number is 303-219-0499. Our email is office@carmenburke.com, and you can also text me to my cell phone, which is 949-394-8031. The following guidelines will help you to ensure optimal healing and a successful treatment outcome. We will give you a bag with some items for you to use. So at the beginning of the appointment or at the end, we're going to give you a bag with a surgical toothbrush to clean the area, with a sterile gauze, with ice pack, your tooth in a pouch, and the printout of the post instructions. And you can ask us any questions. We're going to send you these also before the appointment for you to be ready with some food and to prepare accordingly. Minimize swelling with ice and elevation. Apply ice to the outside of your cheek over the surgery site. You can see here in the photo, the lady's putting that outside. We're going to give you an ice pack, so you're going to leave the office using it on your cheek, but it will be really good if you have some at home. The one that we gave you, that we will give you is just one use. That is really good also if you can have crushed ice inside of the mouth if your teeth sensitivity allows you. Allow the ice to melt inside. Of course, if you don't have sensitivity, I repeat, because if you have, it's not comfortable. But if you can do it, that will be really good for vasoconstriction, so that will stop the bleeding. Elevate your head slightly higher than your heart and sleep elevated for the first 2-3 nights. So you can see how the lady has in the photo 2 pillows and has the medications close to her. Avoid bending down inversions for 6 weeks if the extraction was done in the upper arch. Moist heat. So you do the ice for the first 48 hours, and then you start doing moist heat with water. So you can do 2 cups of water. You put it on the stove and you boil the water, or you just can use anything that boils the water, and then you mix 1 tablespoon of Epsom salt, and you have a washcloth close by, and then you submerge that in the hot water. Just put it on your cheek where the extraction was done on that side, and hot enough that you feel it, but not that you burn your skin. So be careful with that, and just leave it there until the temperature goes down. When the temperature goes down, submerge the washcloth again in the water and repeat the process until the water is cold. That will promote dilation and more circulation, and your blood has all the cells that you need to heal. So we need that to move in the area. Rest is best. Resting is therapeutic and helps your body focus its energy on healing after the procedure. To minimize extensive bleeding, do not become excited or overexerted. So you just overexerted. So sorry. Just avoid heavy lifting, avoid cardio exercises, doing a lot of stuff at home. Just take it easy the first 3 days at least, because it's really important. If you can for a week, that will be better. And it depends on how you feel, but just avoid high impact physical activity. Walkings are really good. So when you go and take a walk, it's really good. You can just do it at a really normal pace, but no run or not too long. You need to check how you feel when you're walking. Listen to your body. And so after a week, you can start doing some exercise that you had been doing before, and just listen to your body. If you feel great, continue. If you feel exhausted, just go and rest more. You will need to change your diet for 4 weeks while you are healing. This is because you have the wound, so we don't want things that have a lot of fibers that can stick in the wound, food that is really hard or sticky or crunchy, because it can just poke the wound and impair the healing. And please avoid everything that requires a lot of chewing, like a steak or things like beef, turkey, and jerky and all that stuff, or the cheese that is really hard. Just avoid that, because the more you chew, the more you can just disturb the healing of the wound. Please don't use anything with seeds, because the seeds can go in the wound and then can also interrupt the healing. And the straw creates a negative pressure, and that can dislodge the clot. So no straw, no hot drinks, no carbonated drinks, or no alcoholic drinks, because they have acidic pH. And our gum will heal also only with neutral pH. So avoid everything that is really acidic, which is carbonation. Try to eat 2 meals per day. Like that, you will let the healing of the wound happen. And that also, just if you need a snack, so a smoothie will be good, but remember, no straw, no seeds until the wound just close. We will let you know in the appointment. Alcoholic drinks, no. So everybody asked me if they can drink beer or wine. So while the healing is happening, at least for the first 4 weeks, we recommend to avoid alcoholic drinks because, as I said, it has an acidic pH, and the gum won't heal if the pH is acidic. We need neutral or alkaline pH for the healing to be faster. Pain management. If your health allows, we highly recommend taking 600 to 800 milligrams of ibuprofen together with 1,000 milligrams of acetaminophen, because these together, they potentiate each other. So the first 72 hours, Tylenol and Advil will be good, but remember, Advil has to be more than 400 milligrams, so that's why we recommend 600 to 800, being 800 the maximum dosage when you do it every 6 hours. So please don't exceed 3,200 milligrams of ibuprofen per day, and do not exceed 4,000 milligrams of Tylenol per day, because that's the maximum doses, and that will be plenty. If you take it together, same cup, they potentiate each other and they work better than narcotics. Arnica is a really good thing to add if your doctor allows it. And just remember, if you're taking the acetaminophen and the 800 milligrams of ibuprofen and you don't feel like it's going well, please contact our office and we will prescribe something stronger if needed. Usually this is plenty for the pain, and people always give us that feedback that it works really good. So inflammation will peak at day 3, 4, so it's important to stay ahead of. Antibiotics. Be sure you take the prescribed antibiotics. We recommend to start 2 days before the surgery and finish the 7 to 10 day course. And discontinue if you see any rash or other adverse reaction, and notify our office, please, because we need to know and change the antibiotics. It will be really good to take antibiotics 1 hour before meal or 2 hours after, because when you eat, the fiber can take the antibiotics, so the effect will be less. And it's good to have some probiotics because sometimes antibiotics can upset your stomach. So please ask your medical doctor before you take it. And also that will be really good if you can take the probiotics. People ask me all the time, what if you're holistic, you recommend antibiotics? So our mouth is in our skull where our brain is, and it's really close to our heart. And we need to, so these dental infections, if we're extracting a tooth, it's because it's really infected and it's not restorable. Otherwise, you could get another treatment. But if we are right now extracting, it's because there is an infection and we want to protect your heart and your brain. So we highly recommend it. We have people that don't want to take them, and then we have to prescribe a stronger antibiotics and longer treatment because secondary infections are harder to manage. And no rinsing, no swishing, no holding water for 4 weeks. Avoid those is crucial to prevent dislodging the blood clot and PRF in the extraction site. If the blood clot, the PRF, becomes dislodged, you may experience dry socket. Dry socket is extremely painful, and you will need to return to the office as soon as possible. If the PRF is dislodged, healing will be interrupted. If the graft is disturbed, good bone formation may not occur. Please no rinsing, no swishing, and no hold water in your mouth. That will be really good for the clot to start transforming in bone and transforming in gum. So we don't want to disrupt that process. No smoking and no vaping, any kind. No, because the heat affects the process, and also any type of smoking can affect the healing as well. So please avoid smoking and vaping. No blowing your nose for 6 weeks if the extraction was done in the upper arch from the premolar area back. If that was done in the front area, that's fine. You can blow your nose, but if it was from the premolar back, please don't, because we need to protect the sinus and the sinus healing. So that is recommended for 6 weeks after the extraction. About sneezing for 6 weeks. So please, if you need to sneeze, don't hold it, because that pressure will also interrupt the healing of the membrane of the sinus, but don't do it really hard because that also move that membrane. So it's trying to heal, and if we move it, so it's going to disrupt the healing. So do it gently, don't hold it, but don't do it really loud. About brushing, no toothpaste for a month. Why? Because these chemicals will disrupt the healing as well. So you can just dip your toothbrush in water and then just brush 2 or 3 teeth at the same time. and dip it again, and that will be enough water to bring to the side and clean. So what really cleans is the bristles and our mechanical motion. So we don't need the toothpaste to be cleaner. And the toothpaste has its place for other things, and it doesn't matter what type of toothpaste you use, if it's very healthy, if it's organic, if it has really good ingredients. At this point, we don't want anything to disrupt the healing. Gently, we're giving you a gauze so you can wipe the teeth that they are adjacent to the area. No electric toothbrush in the quadrant that the extraction or in the arch. So just do it on the opposite arch. And use the new extra soft for post-surgical toothbrush. So the one that we're giving you in the back, you are going to use it for the arch where the extraction was done. You maybe carefully brush and floss the rest of your teeth. So please start from day one, but remember, no water in your mouth like that. We don't disrupt the clot. And avoid areas that they are really tender. And please don't spit. That's why we don't put in water, because no spit. And if you see here the graphic, not electrical toothbrush in the arch where the extraction was done, no toothpaste, and not to spit, because that is also dislodging the cloth. About sutures and membranes. So sutures and membrane, your sutures and membrane will be not dissolvable. Do not worry about if they start becoming loose, because sometimes people heal really well and the inflammation goes down, so the sutures get a little bit loose. Just let us know and we can guide you. We try to keep the membrane and the sutures for 4 weeks to start the healing, and to keep the clot, the bone graft, and everything that we place there. But just let us know if something happened before. But we will give you an appointment 4 weeks after for the follow-up and to remove sutures. Pets on their mouth can potentially lead to bacterial infection, compromise healing, increase inflammation, and that can make your immune response very weak. So please avoid kissing your pets. You can take walk with them. You can give them love and attention, but please don't kiss them anywhere in their body. Don't kiss them, because that will impair the healing for sure. Our whole body functions affect the healing of your dental surgery. It is necessary to get evaluated your gut health, adrenals, neurotransmitters, hormones, especially if you want an implant in the future 4 months later of the extraction, after the extraction. So please just check all of these. You can consult with your naturopathic doctor, nutritioner, integrative medical doctor. If you don't have any practitioner like that, we can recommend one of our beloved patients who have done it and they understand what is this process and they can help you. Please don't take vitamin C before the appointment, since vitamin C could affect the absorption of the local anesthetic, and that could be painful. Self-care products that support healing and recovery, this is optional. Red light therapy is really good to start the healing and to maintain the healing. Basic ozone insufflation package. Of course, everything that we recommend, please consult with your medical doctor. And Himalaya salt neck wrap. So this is in your post instructions. We're sending you these to your email, and we're printing that out when we do the procedure, so you can check those out and see if you would like to have it. Thank you so much for your trust in our practice. We highly appreciate that. And we will do our best to meet your expectations. And so this is, again, our contact information, and let us know if you have any questions, comments, or concerns. Thank you so much.